talk about the scalenes while you're releasing them. So I'm going to get you going in the scalenes. Remember, trachea in the center. Scalenes start down low and even behind the collarbone, up along the trachea, and then up along the side. Most of us have a tendency to tilt our head more to one side or the other. We're listening, right? We're leaning in and listening. You know, if I'm looking at you straight on, it's a little bit of a different feeling than if I tilt my head a little bit toward one side or the other. So I'd like you to take a moment and notice. For me, it's much more comfortable to tilt a little bit to the right. Tilting to the left feels different. It doesn't feel quite as simple or quite as smooth. So I'd like you to notice, is there one side that is just like, that's where my head goes? And maybe that's the way that you lean into life, that you listen. And so that means that the right side, if you tilt to the right side scalenes are going to be much tighter and shorter. That's the side I want to start on. So I'm going to have you start on the side where you tend to tilt. And if you can't figure it out right now, it's just something to explore. Just start on the right side with me, okay? Now, what's interesting about that is that the left side is often the side where the pain is felt or the tension is felt, because that's the side where those muscles are pulled long. So we're going to go right next to the trachea on the right side, or your left, down on the collarbone. Ball rests right on the top of that collarbone. Always the soft ball, please. And then we come right up to that block. And now really start focusing that breath in the belly. Little tiny up and down. And the main trigger point in the scalenes, in the anterior scalenes, those front scalenes, about halfway up the neck. And I just want you to sink in next to the trachea there. And then the anterior scalenes draw us forward for texting to look down. So we're going to go up and down. We're going to nod a little. Stay with me. We're going to keep moving. We're going to keep moving. So right now we're in anterior scalenes on whichever side you're working on, your short side, the side you tend to lean toward. I can't tell you how many people have given themselves chronic migraines, chronic headaches, chronic neck tension, chronic numbness and tingling, just from that little tilt. So now the ball's back down. I'm going to stand up nice and tall. The ball's down at the collarbone. And we're going to start moving out wide a little, not fully perpendicular. Now, this is where it gets a little tricky. This is where that brachial plexus nerve bundle that innervates all the way to the arm and the hands and the fingers passes through the scalenes. So we touched on this last week. Really focusing your breath. These scalenes muscles contract in accidents, in stress, with the tilt. So those are the main things: accidents, stress, worry, fear, all those things. So I can feel that kind of radiating a little bit down my arm. Because we're using this soft air-filled ball, we don't have to worry about nerve damage. We're not going to damage a nerve using this soft ball. And you can kind of go up and down there. Scalenes go all the way up almost to the ear, to C2, second cervical vertebra. So if you have some misalignment, C1, C2, we're going to get up at the base of the skull and the suboccipitals later, but this scalenes, especially if you tilt, might be creating some of those issues. So I'm going to bring my ball up a little higher and sink in below the ear, not quite exactly on the side, just in front of perpendicular. Sink in. And now you can play with it a little bit. You can do little circles with your chin. You could turn your head a little side to side. If you get good at freeing your scalenes, your life is going to significantly change. I cannot express enough how important it is to know how to treat these muscles well. Because who hasn't fallen? Who hasn't had some kind of accident? Who doesn't have stress? And the scalenes gets involved in all of those scenarios. So you could play with a nod, you could play with maybe, you could play with no. And just kind of gently rolling that ball along the scalenes. You could step your body away, bring the ball down just a tiny bit, and sink your body weight into it. Find just that right place. I'm leaning away from this wall a little bit more with my body. I'm going to step back and show you that. So here I am up close. I wanted a little more pressure. So I slid that block down, step my body away, one leg out, one leg stays in close to the wall to support under my body, and then leaning in. That's a lot more body weight. Stepping away, leaning in. Now I have pressure, more pressure, and I'm still using that softball always in the scalenes. It's so good. So we're just going to take 2 more breaths here. Big belly breaths. More neck adjustment, just got a thorax adjustment. 1 more. All right, we're going to move away from the wall. So moving into some slow tilting of the head side to side. Playing with tilting the head side to side. Remember, our ear and our shoulder are not meant to meet, but I just like to show you this. If you look, my head goes good toward the left, right? To the right, it starts pulling right there. I can't go as far. Like, oh, that's pretty good. Oh, it's still sticky on that left side. So we're gonna go do that other side now. And you might take a moment now as you tilt one side to the other. Does it feel a little more even? If you release that short side, does it feel a little easier to go to the opposite side now? Yeah, feels a little less strange now. So we're gonna do scalenes left side. Me, left side, you might be doing right? So we're gonna start down at the collarbone, just lateral, just to the side of the trachea. Sinking in, not compressing on the trachea, and we're doing a little up and down here. Try to keep your head neutral. That's why we use this block, right? We try to keep the head neutral. And if you get up about halfway, and you can move the block as you need so that you're not like scrunching down. If you get the block about halfway up toward the chin, sink in a little bit there and nod, lifting the chin, stretching across that tissue, and then dropping the chin. 3 sets of scalenes muscles on either side of the neck. They're stabilizing muscles. They will always feel firm. They should always feel firm. If they're not firm, your neck would just flop all over the place. So they're stabilizing structural muscles. That's a good thing. However, if they get really fraught with tension, which is different than tone, that's when we have trouble. That's when both sides of the neck is just scrunching down, and you get arthritis and degenerative disc disease, bone spurs, all that kind of stuff, drying of the joints, lots of cracking and popping all the time. We're going to move now a little bit out to the left or to your side. Not directly, I'm not like this. I'm a little bit in front of perpendicular. Ball starts down at the collarbone. And, remember, it might be a little tingly through here. There is nerve supply going through here. Using that soft ball protects you from damaging your nerves as you're doing your self-care. Releasing these muscles will significantly reduce your potential for arthritis in the neck. And it will significantly allow those discs to hydrate in a way that is not possible if the scalenes stay stuck. Truly a game changer, this practice right here. So now as we get in closer, I'm going to bring my ball up into the middle. I'm going to slide away so you can see. I'm going to step away again. I've got that ball higher up now. I'm still not totally perpendicular. I'm right in front of perpendicular. That's where I really access those middle scalenes. I can feel a little bit in my shoulder. I can feel a little bit in my chest, radiating into my chest. Some folks feel it along the shoulder blade in the back of the body. We're going to take 2 more breaths here. I'm going to come back. And you can do a little movement if you like. And you could tilt your head away and back, away and back. Let's go ahead and take 1 more breath here. It felt so good I did more than 2 breaths, I know. All right, we're gonna take that ball off the neck, take that block, and do a check. We wanna do a check. So we're gonna tilt side to side. So much better, so much better. Tilt side to side. I'd like you to drop your chin towards your chest, roll up just to the right side. Drop to the center, roll up to the left. Please don't go all the way around to the back. That is not really recommended for the health of your vertebra in your neck.